Hello, everyone, and welcome back to another session with DentalShadowers. Today, we have an exciting session with Dr. Naglieri. Dr. Naglieri, thank you so much for joining. And on that note, the floor is yours to take away.
Beautiful. Thank you so much for having me. I know there's a couple of my friends watching too, so shout out to all of them who are either watching from the clinic or back up in New York or out in St. Louis. So, like you said, my name is Dr. Naglieri. I am a current second year endodontic resident at UNC Chapel Hill. I just am going to go over my journey from undergraduate to where I am now. And it was kind of a winding path. I didn't really want to do endo when I first started dental school. So I'll go into why I ended up choosing endo and how I got here. So this is me. This was a funny story. We had 4 weddings due to COVID. A couple weddings got canceled. So we had 4 smaller weddings. So this was at our first wedding in St. Louis, Missouri. I was born in Brooklyn, New York, but I grew up in Hershey, Pennsylvania. No, it's not like Willy Wonka and the Chocolate Factory, but you can smell the chocolate from my house. I graduated from the University of Central Florida, National Champs 2017. I graduated there in 2014. I can't believe that's 7 years now. Jeez. And then I decided to stay in Florida where I attended Nova Southeastern University in Fort Lauderdale, Florida. Go Sharks. I graduated in 2018. After dental school, I decided to go back to my roots in Brooklyn, New York, where I did a general practice residency for a year from 2018 to 2019. Sorry, my numbers are a little bit messed up there. My wife, currently, my fiance at the time, was doing orthodontic residency in St. Louis, Missouri after we graduated. So once I was done with my GPR in Brooklyn, New York, I moved out to St. Louis with her and worked as a managing clinical director for Aspen Dental as a private practice dentist. And then from there, I moved to UNC Chapel Hill the very next year to start endodontic residency. So kind of a weird path, but we made it anyway. So this is 18-year-old me. Gosh, I don't know what I was doing with my hair at the time. But UCF is where I called home. It was not my first choice. I grew up a University of Florida Gator fan since I was 11 years old. Why? I liked the colors when I was a kid. So from 11 years old, I made it my goal to attend the University of Florida. But unfortunately, when I was a senior in high school, that did not happen. So I decided to go to University of Central Florida. I figured, hey, I'm in the same state, might as well stay in Florida. I majored in molecular and microbiology. I don't believe that they have that major there anymore. It's biomedical sciences, but it was a very rigorous course. Not many people liked it. I was the nerd of my friend group, so I really liked molecular biology. Just some stats for all you pre-dentals, just to compare. I know things are a little bit different now than they were 7 years ago, but I finished with a 3.72 GPA, so it wasn't a typical 4.0 type of student. I had, struggles as everyone else does. My DAT, my academic average was a 22, and my PAT was a 22. So again, pretty run of the mill. I think the average that year was around 22, 23 when I was applying. Some of the extracurriculars that I did was I stuck with 1 or 2 major extracurriculars to kind of stand out. I know some people will tell pre-dentals apply to every or join every single club, be as involved as possible. But what I found is that most people want to see that you're involved in one group. So I stuck with a pre-health fraternity called Delta Epsilon Mu. If any of you are out there, it's good to see you again. I was also a supplemental instructor for statistics. It's funny because we're taking statistics again now, and I don't remember anything from those classes that I was taking, but I did that for about 3 years. I participated in minor extracurriculars. I was in the pre-dental club, but I really wasn't heavily involved in the pre-dental club. I just didn't have the time. I stuck with Delta Epsilon Mu. I volunteered at Relay for Life, and like I said, I was the nerd of our friend group, so I was in the microbiology club where we would culture bacteria. Yes, sounds super exciting, and it sounds exactly what you think it would be. Towards my junior year, when I really became serious about dentistry, I started shadowing a general dentist in the area. I worked it out with my class schedule. So I shadowed every Thursday morning, 8 a.m. to 1 p.m. And he walked me through his journey of dentistry, similar to what everyone else is doing here, just seeing as much as I possibly could. I didn't have any research experience in undergrad. I know a lot of dental schools love seeing research experience, but don't freak out if you don't have any. It's not going to make or break you. It looks great, but don't do it just to do it. Do it because you at least enjoy it, because research is tough. I did research in dental school and it's very, very time consuming. And this last line, I moved when I was 18. Like I said, I grew up in Hershey, Pennsylvania. I was in a small high school. So if anyone knows UCF, it was one of the largest universities in the country. So it was a big change for me. It was very tough for me to venture out on my own. I didn't have any friends, no family down there. I just went cold turkey, but it turned out to be the greatest experience of my life. So preparing for dental school, this is me. D1 year. Gosh, I look so young. I even had a faux hawk. I don't know what I was thinking. This was my first cavity prep ever. So as you're getting ready for dental school, what can you do? Keep your GPA as high as possible. I'm sure everyone has told you that. Like I said before, be heavily involved in 1 to 2 extracurriculars. I like to say quality over quantity. Mostly in these dental school interviews, they like to see how involved you were in each club. If you were a part of 10 clubs, but you only just showed up to meetings, they may look a little bit down on that. Visit the dental schools. I know it's hard now. I didn't even realize when I was making these presentations that a lot of interviews are on Zoom now. So it's very tough to see these dental schools. But if you can, try and talk to the deans or whoever's working the front desk and see, hey, I see myself at this dental school. I really want to come and visit and just see what the culture is like there. Some schools are very academic in that, you know, they're very research heavy, whereas other schools are more clinical based. Um, and lastly, shadow, see everything. You really have to make sure that dentistry is right for you. I don't know if a lot of you have seen the dental school tuition, but every year I feel like they go up another 10 grand. So it's a big financial commitment. So you really have to make sure that this is what you love to do. And find a hobby that involves fine motor skills. No, video games is not a fine motor skill. I'll admit I said that in a dental school interview because I already talked about that I like to make car models. So they asked me, I forget what the question was, but they asked me and I said, "Oh yeah, I do car models on my free time. That kind of builds my hand skills." And then 2 questions later, they're like, "Okay, so what else do you do for hand skills?" And I already played my hand, so I was like, "Oh, I play Halo." And they're like, "Okay." But I put piano, model building. Some of my friends made jewelry. Just anything to see if you can work with your hands, because dentistry is all your hands, especially endodontics. So applying, I know some of you probably already applied, but early bird gets the worm. Have that application in day one. It's a rolling admission. Same thing for endo when you apply to residencies. So if you're the first one there, you're the first application that they see, you're more likely to get an interview. I took my personal statement to career services in the English department because my grammar, as my lovely co-resident was looking through my presentation, is not the best. So she is still helping me fix my grammar. So the English department's great. That's their major. They love doing that. I took a bunch of mock interviews before. I remember when I applied to NYU, there was a person at UCF that was actually giving interviews, mock interviews, and they went to NYU, so they knew some of the questions that they ask, and they videotape you and they give you feedback. So anything to get feedback and to prepare yourself. Like I said, have everything prepared for the first week or two of submission. I took my DAT after I already submitted my application. I wanted to make sure everything was in. I took my DAT in July. I turned in my application. I believe it was June 1st back in, geez, that was back in 2013 already, almost 10 years. And lastly, if you're getting a letter of recommendation, ask them super early. They forget all the time. I was guilty of it too when some people ask me letters of recommendation. It's very easy for them to slip their mind. I promise you're not bothering them unless you're texting them every hour. Hey, where's my letter? Hey, where's my letter? But just give them a nice little nudge. Give them like a due date of maybe a week or two before when you want it. So when you actually get the dental school interview, like I was talking before, I served on the dental school interview at Nova Southeastern, where we would tour and ask any applicants if they had any questions. We would give them the rundown of the curriculum. So some of the things that we like to see: be on time. It sounds simple, but you'd be surprised of how many people show up late. Dress professionally. One of the main things I'll disclose is just go home and change if you're gonna catch a flight. I don't know why, but it rubbed everyone the wrong way one time. There was an applicant that was in a nice suit, great watch, everything looked nice. They did their interview, they had to go catch a flight. They went and changed. They came out in shorts and a t-shirt. So just wait till you're off campus till you change. Don't bring your phone with you. It looks bad when you're constantly checking your phone or texting people while you're in an interview, because even if dental students are showing you around and say, "Oh, we don't have a say," people will still ask, like, "Oh, what'd you think?" Um, Research the school prior. If they ask any questions, don't give them an answer that's on their dental school website. Um, they want to make sure that you actually look at the school prior. Big thing for me was bring a notepad, write down anything that you saw that maybe you didn't like, or something that you liked, like, oh, their clinic is very nice, or it's a big class, or you have to share a chair when you're third and second year, you have to fight for chairs. um, like I talked about, be professional with dental students. They may say and they may act nice. They may even joke about what they do on the weekends and stuff. Just be careful. Don't tell them that you're going to go and party on the weekend. They're humans too, but still, you're on an interview. Don't act like it. Interact with the other applicants. Try not to be the lone wolf. That's fine if it's tough talking to other people, but just try and make an effort. See where they're coming from. See if they've been on any other interviews, what they've seen, what their experience was. Sometimes I know for me, um, there's different interview dates at different schools, and some of the applicants already interviewed there, so they gave me their feedback. Hey, do this. The dental students are going to do this. They're going to ask you this. So you learn little things here and there. And most importantly, I mean, everyone tells you just be yourself. I mean, they're looking for normal people at that point. Once you get into a dental school interview, they know your stats. You're there to see if you fit in with the culture at the school. And once you're done with the interview, it always helps to write a handwritten thank you card. It still goes a long way. It goes much further than an email, although an email is nice. If you write a handwritten letter, I know my wife, when she went on her interviews for orthodontics, she would write the thank you card that day and give it to them right before she left. When you go home, really see if you can live and thrive in that school. Not every school is going to be the right fit, and that's fine. If the culture is not right, or the tuition is a little bit too high, or you don't want to live in the city, it's fine to say, I didn't like that school. You're interviewing that school just as much as they're interviewing you. Me, my journey, I got into NYU first. I didn't get into any other schools, but I really wanted to go to Nova Southeastern. They waitlisted me. So what did I do? I pestered them over and over. I wrote handwritten letters. I said, "Hey, I got into NYU. I really want to go to Nova. If you take me, like, I will transition right now." I kept sending them my updated scores, my updated GPA. So if you really want to go to a school and you're waitlisted, it's not it's not uncommon for people to get off the wait list. I think half of my dental school class were waitlisted, but they really wanted to see if you really wanted to go to that school. And if you get rejected, it's fine. It happens. That's a way of life. Just email the staff for some feedback. Was it something in my application? Was it something on the interview? They will give you feedback. They won't not email you back. And if you're accepted, awesome. That's great. But still, determine if that school is the right fit. Like I said, tuition just keeps going up and up and up. So sometimes, and there's a lot of Facebook groups out there that say go to the cheapest dental school. Although that's true, yes, go where you feel like you're going to thrive the most. So my dental school, again, was Nova Southeastern. The first day we got there, they said it was the best 4 years you never want to repeat. So, and we were laughing about this today in the clinic in my analogy. Dental school is a marathon that you have to sprint, but a bear is also chasing you. It's just a constant rush of stuff going on. Your first year, you're taking about 64 credit hours for the year, plus national boards, plus you're doing lab work, you're practicing on the weekends. So what life do you have? This is where you really have to rely on your dental school classmates, because they will get you through anything. Your second year is going to be all about lab work. We made dentures, we prepped for crowns, we did orthodontics. When we were in the lab, gosh, I'd say 10 to 11 hours a day. I mean, just making things. It was just, that's why you really have to know that you love working with your hands. All you're going to do. Third year, you finally get patients, but you don't get too many. And you're still taking classes and you're still doing a ton of lab work. So, yeah, it's great that you get patients, but now you're learning how to get patients in the chair, because in dental school, a lot of patients, um, they miss their appointments, or they get frustrated with how long it takes. So this is where you're starting to find how you interact with patients. But once you get to fourth year, you actually start feeling like a dentist, and it feels pretty good. But still working hard. You're still getting accredited for your licensure, and that's a whole nother ball game in itself. This is a picture of me. I was Mr. Tooth for Relay for Life at Nova, and that is my now current wife. So if there's any dental students out here, this is just my stats for when I applied for endo and general practice residency. This is when I graduated. This is my wife, who's now an orthodontist now. My class rank, I was a 42 out of 131. I don't remember. I believe we had 130, 131. So I wasn't number one in my class. I'll be the first one to say that. I wasn't the top of my class. My wife was actually, I think she was like number 10 or 11 in the class. So she was the smart one out of the two of us. I was a treasurer and VP of the Endodontic Club. We did a lot of mission trips. We went twice to Jamaica. That's where we learned how to do extractions. I was a secretary for American Student Dental Association. My wife was the president, so they said that I was the first man. Um, in dental school is where I did a lot of research. So I had a published research project where I worked with rats, and that's where I realized that I wanted to do more surgery in dentistry. We went to a ton of CE conferences. That's where you learn from other experienced dentists, what materials work, what are crowns, like what endodontic procedures work. You see new procedures that have never been done before. I shadowed the endodontic residents on Wednesday nights. I was interested in endo and dental school, but I wasn't fully committed just yet. But endo was one of the procedures that I liked the most. And like I said, I conducted interviews for tours for the candidates, and this is go back and forth. I gained 2 cats, 1 dog, and 1 wife in dental school. So, and if you see my cat running through, I apologize. He kind of likes to interrupt things. These are just some cases. These are my favorite cases that I did in dental school. So the top one, um, this was a patient that wanted a full cosmetic makeover. So what we did is we did full coverage crowns from, basically, I like to say, from ear to ear. Um, these are all porcelain crowns for the patient. The bottom left was my first root canal, and we'll get into what a root canal actually is and what goes into a root canal. The middle one is my first molar root canal. This was actually a very exciting day in my life. My wife makes fun of me for it. Um, and then on the bottom right was an implant case that took me hours. I made that temporary by hand. Gosh, the pros resident, she helped me. She's probably, if she's watching this, she's probably shaking her head of how long and how many times I brought this to her. But this was a bridge. So bridges, an implant, 2 implants connecting 4 teeth, and the patient was very aesthetic driven. So you could imagine how many times I adjusted that, changed the color. Oh, it was rewarding, but it was a nightmare at the same time. So if there's any dental students out there and you're in dental school and you don't know, do I want to specialize? Do I want to stay a general dentist? Try and learn every aspect of every specialty to see what you like. I liked everything. I like doing crowns. I like doing dentures. I like doing extractions in dental school. So I didn't really know exactly what I want to do. I kind of liked it all. And that's why I did a general practice residency. But if you're interested, shadow the residents, local specialists, just see what you like. Try and do more procedures. Uh, don't be afraid to fail. I know most people that go to dental school are perfectionists and they never want to make a mistake, but dental school is the time to make the mistakes. Dentistry, where I learned, is fixing things for other people. You're going to have to learn how to fix your mistakes and fix other people's mistakes. So that's what dentistry mostly is. So don't be afraid to fail. I promise. Mostly every procedure that I did, I had a hiccup on every aspect. And that's why I feel like at this point in my career, I've seen a lot, just because I've made the mistakes. I know where things can go wrong. Find a good group of friends in dental school. It's tough. You're meeting new people. Everyone's kind of wanting to be. You'll get about half the class say they want to do ortho, so they're all going to be studying and trying to be number one in the class. But you'll find a good group of friends that you mesh with, and that you'll be able to lean on when you have 7 tests and 4 projects due in 1 week, and you just need someone to hang out with and just kind of vent and get through it. Your experience is heavily dependent on yourself. Dental school, in my opinion, just to get by is not too difficult. Yeah, you have requirements, may be tough if you don't get that patient. But on the whole, the requirements aren't super out of the realm. But my advice would be go above and beyond, try and do as much as possible, try and do as many crowns as you can, try and do as many root canals as possible. See those dentures that you don't like, because it's very easy to just show up, do the bare minimum, and then graduate. And then when you get out, it's very difficult to go to CE while you're running a practice. So my advice is try and do as much as you possibly could in dental school. Find good mentors in clinic. There's going to be a ton of experienced dentists that are there and offer their wisdom. Learn from them, even if it's something that you don't agree with or it's something from the 1960s. That's perfectly fine. The old methods, sometimes they still work. So even though it doesn't sound super cool, it worked for them, so it may work for you. Practice, practice, practice. We teach the dental students in at our school, and one thing I always tell them is that you're only going to get better the more you practice. It's not going to be 1 or 2 teeth that you do and you're going to be perfect at it. You got to do hundreds of it. And if you're not specializing, if you really don't want to specialize, I strongly recommend doing a GPR or an AEGD. It really accelerates your career, and I'll get into the difference between the two. So GPR is a general practice residency, and AEGD is more advanced education and general dentistry. Um, GPRs are more hospital based, whereas AEGDs are more academic based, but that's not a hard term. They interchange here and there. You'll see some AEGDs in the hospital, you'll see some GPRs in academic settings. So after I graduated, I did a general practice residency. So this was a full year of high pace, difficult cases, difficult patients, difficult environment for a full year. This is where I really learned how to do dentistry. I felt like I was very good coming out of dental school, but this was a whole nother level. You go from seeing maybe 4 patients in dental school to a GPR where I was seeing 16 patients a day, sometimes more. This is where I learned root canals. I did a lot of surgeries. I did a lot of implants. And I learned how to fix almost everything. Um, we're picking up a lot of cases from old residents, and things may not have gone well. And once they graduate, they're not really looking at the cases anymore. So it's up to us to pick up where they left off and fix any mistake that went wrong. Almost like every patient, you're trying to fix something. In a GPR, at least for mine, they're all a little bit different. I was on call every 9th day, and I slept at the hospital. We would be on call from 7 a.m. till 7 a.m. the next day. Kings County, if anyone's ever heard of it, it's in Crown Heights, New York, Brooklyn, New York. It was a level 1 trauma center. So even as a general dentist, we saw GSW means a gunshot wound. We saw stabbings. We saw a lot of patients that needed swellings drained in the middle of the night. So it was pretty hectic, and it was intense. But coming out of that, it was kind of one of those, okay, I've seen it all. Nothing's going to surprise me when I get out to private practice. This is where I really gained my love and interest for endodontics. My attending, Dr. Farrak, he really pushed me because he saw that I was interested in endo. So he was a recently graduated endodontist, board certified, and he would walk me through every tough case. He would bring different materials for me to try, and he really pushed me into becoming an endodontist. And my friend, his name is Dr. Rakin, he also pushed me to become an endodontist. So this is where I really solidified, and this is when I started applying to endodontic residency. And that's me. This was before residency started, so I had a big smile on my face. So things changed after the year. So this is what this is what a year of Kings County Hospital GPR looks like. On the left, this is me after a long day. I had just placed 2 implants. I was exhausted. I think I was sleeping in this picture, but this is the operatories in the hospital. Not the most fancy thing in the world, but you make do. You learn to love what you have. These were my 9 other co-residents with my program director, peds attending, and GPR or general practice attending. I still keep in touch with all of them. They're all great. There's actually 2 other endodontists in this group. And then on the right, this is me. I think this was maybe 2 a.m. We were really busy. I was actually applying to endodontic programs at this time. So if you could see, there's a little bunk bed. That's where you sleep at night. I, for some reason, didn't like the bunk bed. I felt weird sleeping on the top bunk because the oral surgeon would sleep on the bottom. So I slept on the couch. I was short enough that I just fit the couch. It was a small couch. So perks of being a little bit short. And these are some of the cases that you'd see in a general practice residency. On the left, top left, these were 2 implants I placed just as I was leaving. Right in the top middle, this was a sinus lift. So this is basically, I'm sorry. So sinus lift is essentially when a sinus hangs too low to the bone, then you have to go in surgically and literally just lift it. It looks like a little, if you ever peel an egg, it's like a little membrane. So you have to be very careful not to pop it. So we lifted the sinus. All of these little particles here are bone graft to fill in the space. And then those are 2 implants that I placed. Top right, where patient was very aesthetically driven and she had some staining on her teeth. So these 2 teeth right in the middle, these are premolars. These were actually crowns. And that was probably the best shade matching that I had in my career. I wish I had amazing shade matching when I was in private practice. On the bottom left, my wife will probably, she always yells at me for doing ortho since she says that she's the one that's going to stick to ortho. But I got to try my hand in orthodont treatment. So I placed these brackets and we closed the space for this patient. Right in the middle, another implant. This was a front tooth for a patient that had the tooth knocked out when they were younger. 2 root canals right in the middle. These are actually these crowns on the top right. And then on the bottom right, this was actually a full arch rehabilitation. So these are all crowns because the patient had broken down and missing teeth. So we replaced everything in that arch, and that was a very hard case. That took me a long time to do. So once I was done with my GPR, I was graciously accepted into UNC Endodontic residency, where I currently reside. This was me. This was actually a year before residency started. So Endo accepts people a year in advance. So you have a full year to wait until you start your program. So in that year, I worked for a private practice out in St. Louis, Missouri, with my wife, and yeah, that was a good year. But I was ready to get into endo residency. These are all my co-residents, right in the middle. Um, they have been great these last years. Most of them have done similar journey to what I had, so it's nice always talking about different experiences. And if anyone knows UNC Chapel Hill, I learned this. It's actually good luck to drink from the fountain, so hopefully it worked. So, what everyone may be wondering is what actually is endodontics. So, it is a specialty of dentistry that treats the nerve of the tooth. So, our goal as endodontists is to prevent and treat what they call apical periodontitis. What is apical periodontitis? It's basically an infection of the dental pulp. It's when the pulp dies and patients get swollen or they have an infection at the root of their tooth. We are the specialists of keeping natural teeth. So, whereas oral surgeons and periodontists may take out teeth and put implants, we do our best to keep your natural tooth. We are the root canal doctors. And I know a lot of people say, "Oh, it's just as bad as getting a root canal." So most patients are very scared to come see us, and there's a fear of put around root canal in movies and in the old days, but it's actually not bad. A lot of patients sleep in the chair or they leave and they're like, "Oh, I was really bored. It wasn't so bad." So the patients that we get to us are mostly in tooth pain. They come with us holding their face, or they have ice, or they've taken ibuprofen or Tylenol, and they're really not happy when they come see us. They're in a lot of pain. They've been in pain for weeks, or they've been swollen. So we get to alleviate their pain and help them live a better life just because they're in so much pain. I mean, I had a patient today that I saw on consult who hadn't slept in 2 days. So it's nice to get those patients and really help them out of pain. Some of the other patients that we treat are patients that need root canals that may not be in pain, but the anatomy of the tooth is a little bit too complicated and the general dentist doesn't feel comfortable initiating the treatment. And I'll show you some cases of what I mean by difficult cases. Um, for the pre-dentals, I know you may not have seen too much about what a root of a tooth looks like, but you could see some uncommon anatomy. Some patients can't open very wide, so we have to use special materials, or they've had root canal treatment in the past that failed, and we need to either fix it, like I said, or go to surgery. So the procedures that endodontists perform, the main thing is a non-surgical root canal therapy. That is a basic root canal. This is what it looks like on a radiograph or an X-ray. So that tooth on the right, that is tooth number 15, the top left tooth all the way in the back. This is what, if you ever take an X-ray, what a root canal looks like. You can see that the roots of the tooth are filled with this whitish material, and we disinfect the inside of the tooth, and the patient leaves happy. Next one is a retreatment therapy. So say this root canal, for whatever reason, fails, they're still getting an infection. We go in, we take out all this old material, put new medicine in, and then refill it. We also deal with resorption repair. Resorption is basically when a tooth undergoes trauma. Either someone was either playing basketball, got hit in the face, or took a fall, or I had one that ran into a door. Um, there are cells in the around the tooth that see the tooth as a threat and start eating the tooth. So basically, we go in surgically and we take out all those cells and fill it up. We are a big manager of trauma. So any kids or patients that are in any accidents that, for whatever reason, their tooth falls out, we have to manage and either put the tooth back in, we do the root canal outside the mouth, or we just watch and make sure that that tooth has a long lifespan even after the trauma. Another one is apical microsurgery. That's basically if we can't do a root canal from the top of the tooth, what we'll do is we'll fold the gums back, drill through the bone, and go right to where the end of the tooth is and cut off the root directly. So it sounds interesting, and the procedure is actually very fun. But yeah, we're not just the root canal doctors. We handle a lot of other procedures. And recently, a lot of endodontists, or maybe not a lot of endodontists, but some endodontists have started placing implants. A little less common, but some endodontists still place implants. This is a picture of what a retreatment looks like. This was a tooth that I opened up, and that orange that you see right there, that's all filling material that was left by the previous provider. This is what resorption repair looks like. Like I said, this tooth had cells that were eating itself, and what we do is we remove all those cells and we put a new filling material here, and then we'll stitch it back up. And the tooth, this patient's actually feeling great. I actually talked to her a couple of days ago. And then this is what apical microsurgery looks like. So this is a picture of what the end of the root of a tooth looks like. So what we do is we go in here and we just cut off the end of it and then fill it from the opposite end. And this is trauma. This patient actually lost this tooth right in the middle. So what we did was we cleaned it, we put it back in, and we splinted it. And he's currently feeling great. We did the root canal on this tooth, and he's back to business. So what do we do when a patient comes? We do diagnostic tests, and we figure out what tooth is bothering the patient. We do something called vitality testing. This is to see if the tooth is actually alive. So what we do is this picture in the middle. This is called endo ice. I love how they put cold as ice, kind of like the song. What we'll do is we'll spray this. It's kind of like dry ice type. You spray it on a cotton pellet, and it brings the temperature down to about negative 20 degrees Fahrenheit. And you'll place it on a tooth, and then the patient will raise their hand if they feel it, or they won't put their hand up. If they don't put their hand up, that means that the tooth is dead and it has an infection. But if they raise their hand, that means the tooth is still alive. If a patient is in pain and you put the cold on their tooth, they will raise their hand very, very, very high, and they will say, "Ow, that hurt really bad." But at least you know what tooth it is. You also have heat test. That's when a tooth is just about to die. That's when the nerve is on its last leg. EPT It's this machine on the right. It basically sends an electrical signal through the tooth. I had a patient today describe it. If you've ever touched an electric fence, that's what it feels like in your tooth. And that's just another way of us determining if the tooth is alive or not. Percussion, what that means is basically just tapping on the tooth. When a tooth has an infection, there's a lot of pressure that builds up at the end of the tooth. So when you tap on it, it causes some pain, and that's a good distinguisher to see if how bad the infection is. Palpation is basically just running your hand around the gums if there's any swelling. If there's a swelling and you press down, the patient's going to say, "Yeah, that hurts." Transillumination, this is mostly for teeth that are cracked. You shut your headlight off and you'll put a little tiny light over the tooth and you'll be able to see if there's any large cracks in the tooth. And lastly, what every specialist and what every general dentist should do at every single visit is an oral cancer screening. Oral cancer is one of the most misdiagnosed ailments in patients, so it's always good to have another set of eyes checking the patient. So some of the important terms in endodontics that we use every single day: pulp. This contains the nerve, blood vessels, and nutrients to the tooth. This is sort of what makes the tooth alive. Vital. This is that a tooth is alive and healthy and a patient responds to testing. Necrotic, basically what I tell patients is that it's a dead tooth. So all the contents in the pulp are infected and no longer alive. Bacteria, the main reason why we do root canal treatment is that bacteria are getting into the pulp and causing this infection. Cleaning and shaping, this means that we go inside and we literally clean and shape the root canals with instruments. Irrigation, one of the most important aspects of endodontics, is basically using disinfecting agents to sterilize a tooth. Sodium hypochlorite is our main disinfectant. It sounds very fancy, sodium hypochlorite, but if anyone had shadowed a dentist and they watched them do a root canal and they say, "It smells like bleach," you'd be correct. It is bleach. Obturation, this is what we fill the tooth with. It's a three-dimensional filling of all the canal space. What we use mostly as endodontists is what they call gutta percha. It's made from zinc oxide and a rubber type of material, and it's very antibacterial, so it helps prevent any reinfections after we've cleaned it. So some of the steps in a root canal procedure. Forgive my pictures. I was doing this last week in the clinic. My co-residents were like, "What are you doing?" So the first thing that we're going to do is we're going to isolate the tooth in question with a rubber dam. A rubber dam is this latex type. It's not, they're non-latex. I think the ones we have are nitrile. Basically what this does is it isolates the tooth and it keeps everything sterile. It keeps any saliva from getting inside the tooth or any bacteria that we want to take out of the tooth. Next, you're going to access the pulp chamber where the pulp is and remove caries. Caries, if anyone doesn't know, is basically decay. That's the scientific term of decay. Next, you're going to use a type of explorer. It's very pointy. It's not the traditional curved explorer. It's a straight line. It helps us locate all the canals in a tooth. And you could see in this picture, this explorer is going right into one of the canals of the tooth. This tooth had 3 canals. So once you find all your canals, you need to know the length of each canal because you're doing all of this blind, essentially. You're using tactile feel with files to know where the end of the root is. How do you know where the end of the root is? You use a machine like this. This is called an apex locator. It's a little tough to see, but you can see it has a 3, 2, 1, and then at the bottom of the red, it says apex. You'll use little files like this. This is called a 10K file. These little files, you're going to work with your fingers all the way to the end. And it's attached to this clip that runs all the way to the apex locator. And it's going to beep multiple times. And the closer you get to the end of the root, it's going to stay like a flat line. If you're ever doing a root canal, especially dental students, let the patient know that it's going to beep. They are not flatlining. It's just the apex locator that you're using. Some patients freak out a little bit. Once you know all the lengths of the tooth, you're going to take what they call rotary instruments. These are basically files that are on your handpiece and they spin super fast and they're going to enlarge those canals so you can fit disinfectant down them. This is when you're going to disinfect the tooth with sodium hypochlorite or bleach. For any dentists out there, please, if you want, dilute your bleach from the Clorox to half the length, just in case. Once you're all disinfected, you're going to dry the canals and you're going to fill it with gutta percha. So this is that filling material that I talked about that is a rubber based. Like I said, it's from zinc oxide. It's very antibacterial. They look like little cones, little orange cones. So you'll fit each one, and the numbers relate to the size of the cone. And then lastly, you're going to place a temporary filling and send it back to the dentist for hopefully the patient gets a crown. So some of the new technologies in endodontics, the main one is the dental microscope. I wouldn't say it's new to endodontics, but it's the most important thing that we have. If any of you have seen what dental loops are, loops go up to about 6 times magnification. Most dental students have 2.5 loops. These can go up to 16 times and even 20 times. I think ours goes up to 20 times. So it helps us see very small canals and where the nerves are. CBCT, this stands for cone beam computed tomography. Basically, it lets us see the teeth in 3 dimensions. So we're able to plan and see exactly if there's any nerves that we just can't find. This will help us locate and we could measure exactly where those canals are. Like I said, irrigation is one of the most important technologies in endodontics. We're always trying to find new ways to disinfect the tooth. So they have negative pressure irrigation techniques. They have something called a gentle wave where you fit a little handpiece over the tooth and it runs sodium hypochlorite through the tooth while you walk away and get some coffee. You can also use lasers to disinfect the tooth, which are really cool. That's kind of a hot topic in endodontics. A new one that hasn't gained too much traction, but it's one of my favorite, is what they call guided access. Basically, if a tooth is very, very difficult, or you look on an X-ray and you can barely see where the nerve is, you can use your CBCT and fabricate this 3D guide that will essentially place you right where the canal or the nerve is. Like I said, it hasn't really gained too much traction. Some endodontists use it, but it's still in its infancy, so it has a long way to come. And lastly, regenerative endodontics. This was the hot topic, still is the hot topic in endodontics. Basically, in teeth that are necrotic or dead or have an infection, but they're not fully developed yet. So mostly in kids. Essentially, what they'll do is they'll perform a procedure where they can get the vitality or the lifeness back to the tooth using stem cells at the bottom of the tooth. So really cool. I haven't gotten to done one of those procedures yet, but hopefully it's coming up. So a typical day, at least my typical day, I know some of my co-residents like, you wake up at 6 a.m.? I wake up at 6 a.m. I get to campus. I arrive a little bit earlier just to set up instruments and kind of eat breakfast and look through my cases for the day just to make sure that I have a plan for everything that's going to go on. My first treatment's at 8, seconds at 10. At lunch, our program director and our co-residents, we have a PlayStation in our resident room. So I put FIFA because they'll play FIFA all day if they could. So it gets pretty intense there. So it's a nice little relaxation time before the afternoon. 1 and 3 p.m. I'll see my 3rd and 4th patients. Once 6 p.m. comes is usually when I get home. I'll write all my notes for the day. I'll work out, eat dinner, and then at 8 p.m. every week, especially in endodontic residency, the main thing is we learn a lot of literature reviews. So a lot of articles and scientific papers that were published years ago by other top endodontists, and we have to know exactly what procedures they did so that when we present our cases, we have a justification to say why we did it. So I'll do that for about 2 hours, and then hopefully I'll get to bed at 10 p.m. Usually I'll be up till 12 trying to read and do some other things. Also, we rotate through different rotations. Monday, for example, you could be on urgent care. So basically, you'll cover patients that are in pain and you'll elicit emergency treatment to them. Tuesday, you could be on consults. So basically, you'll have 4 exam patients where you need to diagnose. And you also have a little beeper, which is what I was on today. The entire school, all the departments, so dental students, periodontics, oral surgery, pediatrics, they can page that number if they have any endodontic questions. So you're running from department to department and offering your advice to different patients. On Wednesday mornings, we do what they call case analysis. So you'll take 3 cases and you'll present it in front of all your co-residents and all your attending faculty. And basically it's to get you ready for a board. So it's very stressful for us. It's a very good learning opportunity, but their goal is to make sure that you know why you're doing what you do. So they'll grill you with questions for maybe 2-3 hours. So it takes a lot of planning for that. We'll have patients in the afternoon on Wednesday. Thursday, a lot of us go to the prison on a rotation where we do all the root canals for inmates in the entire state of North Carolina. And Friday at 7 a.m., we go to PEDS trauma. So we learn about any trauma cases that the pediatric residents are presenting, and we'll present some of our own, but we mainly deal with adults. So sadly, the pediatric residents don't really want to listen to us talk about adults. We have patients the rest of the morning on Friday. And then in the afternoon, that's where we have our literature review, where we review usually 18 to 25 articles a week. And we just discuss what we found, what papers are worthwhile to remember, little tidbits, what to find in each paper. So this is what our clinic looks like. This is what I walk into every day. This is at 7 a.m. in the morning, so kind of quiet. During the day, you can imagine there's people running left and right. There's assistants, residents, dental students all running through. This is what my op looks like. A little dirty. You could see my I Heart Endo box in the back. So I have a nice little operatory. They even had a little nice name plaque for me. I have never had that before. And this is me using the dental microscope. I didn't have a patient at the time. I wanted to take this picture just because of HIPAA and everything. But this is what a traditional setup for me looks like. You can see all my instruments in the background to the left and to the right. Since COVID, we have a shield around our microscope just to prevent us from aerosols. And yeah, it takes a while to get used to that microscope. So what I am seeing, and I'll show you, what a normal dentist will see, this is at about, I'd say 3.5, 4.5 loops. So a great magnification, you could see a lot, but with a dental microscope, you could see up to 16 or 20 times magnification. So I could see exactly into that tooth. It's a very, very, very tiny space. So that's where the dental microscope really comes into play. And this is what a nerve actually looks like. I know the clarity, my camera was in focus of the background for some reason, but this is what a dental nerve looks like. It looks like a little worm. So every now and then you're able to pull it out in one piece and kind of say, yay, I pulled it out in one piece. It makes our life a little bit easier instead of breaking it up into little pieces. So yeah, I usually tell the patient, I'll show them, I said, oh, look, your tooth had a little worm in it. And then they'll say, oh, what? So just some cases that I wanted to show you. This was, if anyone followed my Instagram, this was one of my cases back in April. I presented this to my co-residents too. This is a 41-year-old male. He presented for, this is tooth number 20. He came to me and said, oh, my dentist started this filling, but he says that the nerve is dead. So as you can see, this big white chunk on both teeth, very bright white, this is what amalgam filling. This is a silver filling. And you could see at the end of the root of this premolar is there is a little dark spot here. I don't know if you could see my cursor, but there's a dark spot here. So that means that there's an infection on this tooth. So this is how we present things in endodontic residency. We go through the history of present illness for every case. Basically, the gist of it is that he was only having pain when he bit down on the tooth. He didn't have any thermal sensitivity, so nothing to hot and cold bothered him. So basically, in patients like this that will say, oh, it only hurts when I bite down, the nerve died either recently or years ago. And with that added pressure at the bottom of the tooth, they're feeling pain when they bite down. So our goal is to go in and disinfect the tooth of all the bacteria so the body can clear up the infection. This is a typical, again, this is what endodontic residents like to present. So like we talked about with our diagnostic testing, for that tooth in question, it was tooth number 20 with the endo ice. So when you put that ice on that tooth, the patient didn't raise their hand. They didn't feel anything. But when you tapped on the tooth, they raised their hand and said, ow, doc, that really hurts. And with the electric, the EPT, when you put that electrical shock, the minus and the 80 means that they didn't feel any electrical shock. So it was safe to say that this tooth was dead. So this is what it looks like when you go in. This is a X-ray showing what my cones look like to make sure that I'm all the way at the end of the root. And this is how endodontists will verify, can we finish the root canal? Do we feel good enough that we've cleaned the entire root? Or are we a little bit short? Do we need to go a little bit longer to clean out the end of the root? Or are we too long and do we need to pull back so our filling material is not in the bone? And this is what the final looked like. The main thing that I loved about this case is most of these premolars, and if any dental students are here, most of these premolars have one single canal, very easy tooth to treat. This one had 3 canals, and they all 3 of them split about halfway down the root. So that's where the microscope really comes in handy. I could see where each canal was, and I was able to navigate around all 3. So these are the type of cases that general dentists, although they most likely can do it, it just takes them a lot longer when they could be doing other procedures for patients. So next, this was a root canal of number 15. So this is the top left tooth. This was a 22-year-old male that presented. He kept saying that his top left tooth hurt really bad last week, but stopped the other day. So basically his nerve was just about dead, and he came to me, the nerve was finally dead. So these are what the x-rays look like of tooth number 15. It is this tooth right here. He still has his wisdom tooth. And if you could see, the main thing I want you all to see is that all this dark shadow on this tooth is all decay. And this tiny little dot here is where the pulp is. So you could see that the decay is right on top of that nerve. So what it did was some bacteria just made it through that little wall and basically killed everything inside the tooth. So it's our job to go in, remove all this decay, disinfect it, and clean it from the bottom up. So again, they call it master cone. This is where those filling cones fit in. This is just to tell us as endodontists, are we at the end of the root or do we need to make some adjustments? So here, everything seemed to be a little bit, or seemed to be good. You could see this bigger root. This is the palatal root. This is the biggest root. You can see it's a little bit long. So what I did was I just took some scissors and cut the end of it. And this is what the end of that root canal looks like. These little puffs here, they call it sealer. It's a material that coats the cones just to make sure that it seals any extra voids or any space that may be in the tooth still. And lastly, I had a young girl a couple months ago. She presented tooth number 18. So this is the bottom left tooth. She said that her tooth hurt really bad when she drinks something cold. So tooth is still alive, but causing her a lot of pain. And this is what it looked like. This is tooth number 18. You could see this big cavity on they call this the mesial side. Mesial is more when it's towards the midline. And she still has her wisdom tooth. But the main thing to see here is she has one really big canal and then one small canal. So what ended up happening is it was a really big canal on the distal side, and then on the mesial side, she actually had 3 canals. So surprise, surprise, this is what it looks like through my microscope. So you could see 1, 2, 3 canals, and the 4th one was that big, they call it a distal canal. And on the picture all the way to the right, you could see how many cones I had to use just to fill this tooth. So this is 6 cones in one tooth. So 3 cones in one canal, and then I had 1 cone per canal. And this is what it looks like. This is the final product. So we put a temporary filling here. She's off to her general dentist to get a crown. So you could see straight on x-ray this tooth. It looks like it has one nerve on this mesial side, one big distal. But when you take the x-ray and you shift it slightly, you could see all 3 canals right here. So I want to thank you all for having me this evening. Hopefully I didn't bore you too much. I know endodontics is sometimes a little bit boring. The main advice I'd say to you all, especially if you're in endodontics, make sure you really love the specialty that you want to do, because this is what you're going to be doing for the rest of your life. The dentist that I used to shadow, he always said, I don't know how endodontists do it. They just stare at a hole all day for 30 years. I don't know how they do it. So just make sure you love what you do. And again, my biggest advice, don't be afraid to fail. It's how you learn. Try every procedure you possibly could. And if it doesn't work out, then you know what to do for the next time. It's okay to fail. That's how you learn. So thank you guys. And this is my social media down here. You guys can message me if you have any questions about applying to endodontic residency. If there's any dental students out there that are interested in endo, feel free to message me and I can walk you through the whole application process of endodontics. It's a little crazy. So if you guys have any questions,
Thank you so much. That was an extremely informative session.
oh, thank
So Isabel here is going to be reading out some questions that we have on our YouTube chat. If that's okay
you.
with you.
Yes, thank you. That was a great presentation. And from our chat, we have a couple of questions. So our first one is there anything you wish you knew before your endodontics residency?
Um, anything I wish I knew before endodontics. I wish I knew how to use the microscope. It took me a really long time to get used to, and it gave me a lot of headaches prior to. And I wish I knew how many different procedures we covered. I never realized how many trauma cases that we would see. I was experienced in trauma, but I didn't realize how many trauma cases we actually deal with. But I would say the microscope is the biggest one. I wish I knew how to use that. But endodontic residency has been great so far. Now, my program is a 3-year program. I knew that going in. Most endodontic programs are 2 years, but we do a lot of research, and our program is built more towards families, so people that have kids and are married. So it's kind of 2 years stretched out into 3, so it's a little bit more relaxed.
Awesome, thank you. Our next question is, do endodontic residencies accept many GPR grads?
They accept a lot of GPR grads. I would say, and this is just my opinion, a lot of endodontic residencies like dentists with experience prior. That's not to say that they don't take people right out of school. We have a couple people in my residency that came right out of dental school, but it really helps. I'm not saying don't, if you have the opportunity to go straight out of school and you really want to do endodontics, do it. But if you feel like you want some more experience, they love people that do GPR just because you've seen a little bit more, you know how to prep teeth, you know diagnosis, you know what to see, and you've probably done a few root canals in your GPR. So I think that was the biggest help for me going into endodontic residency is I had a lot of experience prior. So nothing really surprised me when I first started. The techniques, yeah, and microscope and working canals and filling teeth, but the basics were there already.
Awesome. And just to wrap things up, we have one last question. Do you remember how many shadowing hours you went into dental school with?
I went in, I would say about 150 to 200. Now I shadowed basically the end of my sophomore year, starting junior year. So that was about 2 years. And I went every Thursday for about 4 hours each. So I think I put on my application about 150 to 200. A lot of dental schools, they look for that 100 mark. So if you're not at 150, 200, don't freak out. It's not bad. Just get as much shadowing as possible.
So unfortunately, it looks like that's all the time we have today. Dr. Naglieri, thank you so much for joining. This
Of
was a
course.
very unique opportunity, and we thank you for joining. And we also thank all our viewers for joining in today's session. If you guys have any other questions, please make sure to check out Dr. Naglieri's Instagram. And on that note, I hope you all have a great rest.